9 warning signs of stroke 1 month before. Feeling strange changes in your body can be scary, especially if they might mean you're about to have a stroke. But don't worry, you're not alone. We're here to help you recognize early warning signs of a stroke, up to 30 days before it can happen. Join us in this video where we'll reveal 9 surprising warning signs of a stroke. Life is busy, and we often ignore what our bodies are trying to tell us. Take a moment to watch this video and learn these important signals. It's not just about staying healthy. It's also about taking care of yourself. Watch and share our video so everyone can know these valuable signs and live a happy, healthy life. Number 1. High blood pressure. High blood pressure is the main risk for having a stroke. Think of blood pressure as the force your blood puts on your artery walls when your heart pumps it around your body. A normal blood pressure is 120 by 80. But if you often have numbers higher than 140 by 90, it means you have high blood pressure. This problem puts extra stress on your heart and can damage the blood vessels in your brain. Now, high blood pressure can make the weak spots in blood vessel walls get worse quickly. It can also cause little clumps in your blood that can block blood going to your brain. This is dangerous and can lead to a stroke. The higher your blood pressure, the greater your risk of a stroke, so it's important to control it. Why do some people get high blood pressure? It's usually not just one thing. A lot of factors can raise your risk, like your family history, getting older, being overweight, drinking alcohol, smoking, having diabetes, or eating too much salt. But don't worry, you can do something about it. Keeping an eye on your blood pressure and talking to your doctor regularly can help. Making changes to how you live, like exercising and staying at a healthy weight, can greatly improve your blood pressure. Number 2. Vision problems. Imagine your brain is like a busy city, and the blood vessels are like roads that bring food and oxygen to all the city's neighborhoods, which are like different parts of the brain. Now, if there's a problem on the roads, like a traffic jam or a closed road, some neighborhoods might not get what they need. This is like what happens in a stroke. The blood can't get to parts of the brain because of a blockage or a bleed. Vision problems can be like traffic warnings. They tell us that something could be going wrong with the roads to the brain. When you have trouble seeing clearly, see double, or suddenly can't see out of one or both eyes, it's like your body's warning lights are flashing. It's telling you that the blood flow to the part of your brain that controls your sight might be in trouble. So if you get these vision warnings, it's a good idea to pay attention and get it checked out, just like you would if you saw a bunch of warning signs on the road while driving. It could help prevent something worse, like a stroke, where parts of the brain could get damaged because they're not getting enough blood. Number 3. Fatigue. Imagine your body is like a car. If it's running low on fuel or isn't well maintained, it won't work properly. Now, fatigue is like the car's dashboard light turning on to say, hey, something's not right. When you're always tired, it's like your body is trying to give you a heads up that there might be a serious problem, like how a stroke can sneak up on you. Feeling wiped out all the time isn't just about needing more sleep. It's your body's way of whispering that it's struggling. Not getting enough sleep is a big deal here because it puts extra strain on your body's system, kind of like pushing a car too hard without giving it a break. Stress is like the invisible rust that can slowly damage your car without you seeing it right away. It quietly eats away at your health, and if it goes on for too long, it can make things worse. Then there's your diet. Think of it as the type of oil you use in your car. If you use the wrong kind, it can mess up how the car runs. In the same way, if you don't eat the right foods, it can upset your body's natural balance, and that can lead to a higher chance of having a stroke. So, feeling super tired all the time might be a small warning signal that's worth paying attention to, because it could be linked to bigger issues like a stroke. Number 4. Numbness or weakness in limbs. If your face, arm, or leg feels numb or weak, it could be something serious like a stroke. Let's look at why you might feel this way. It could be because of pinched nerves, arthritis, or carpal tunnel syndrome, which often make parts of your body feel numb or weak. These symptoms can also be linked to strokes. It's like your body is giving you hints that you shouldn't ignore. If you feel this way and it's happening with other symptoms, you should do something about it right away. Number 5. Sudden headaches. Sudden really bad headaches can be a sign from your body, telling you something's wrong, especially if you also feel other symptoms. There are different types of headaches, like tension headaches, migraines, and headaches from sinus infections. But remember, if you have a really bad headache and other symptoms, It could be a warning about a stroke. Understanding these warning signs can help us react fast and possibly reduce the chance of a stroke. So, we should take these warnings seriously to stay healthy. Number 6. Memory problems. For a lot of people, forgetting things more often is just a part of getting older. But new studies show that these memory slips could warn us about a stroke. Researchers at Erasmus University Rotterdam looked into how forgetting things might show bigger health issues. They shared in the Stroke Journal that forgetting stuff might mean a bigger chance of having a stroke, especially for people who have gone to college or have advanced training. Before this, we knew that strokes could cause memory problems, but this new research is checking if trouble with memory can actually come before a stroke. They found that people with better education who said they were forgetting things had a 39% higher risk of having a stroke. This was especially about people who had a college education or similar. Number 7. Difficulty speaking. If you suddenly have trouble speaking, it's important to take it seriously because it could be a warning that something is wrong with your brain. If you're stuttering, slurring, or can't find the right words, it's like your brain and mouth aren't working together properly. Understanding that these speech issues can be signs of a stroke is really important. Think of it as your body telling you that you need to pay attention. If you're having these speaking problems, especially with other stroke symptoms, it means you should do something about it quickly. Number 8. Nausea and vomiting. Feeling sick to your stomach and throwing up can sometimes warn you that a stroke might happen soon. This is because they can be caused by problems with blood flow to the brain. The brain needs a steady flow of blood, which brings it oxygen and food. If a stroke disrupts this flow, the brain starts to have trouble working right, and this can make you feel sick and throw up. The brain controls everything, including your stomach. So, if it doesn't get enough blood, it can't control things well, and you might start feeling sick or vomiting as the brain tries to fix the problem. However, these symptoms can be caused by many things, not just strokes. Bad food can make your stomach upset and cause these symptoms. Viruses, especially those that affect your belly, can make you throw up as your body tries to get rid of them. Also, if your eyes and inner ears get mixed up signals, like when you're reading in a moving car, you can feel seasick and might throw up. Number 9. Loss of balance. Falling off balance is a big sign that someone might be having a stroke. This happens because it shows there may be damage to the part of the brain that helps us move smoothly and stay steady. When this part is not working right, people can become unsteady and fall. Balance can be thrown off by problems in the inner ear, weak muscles, or side effects from medicine. Inner ear issues can mess up the messages about where we are in space that go to the brain, making us feel off balance. Weak muscles from health problems can make it hard to stay up straight or adjust our position. Some medicines can make us feel dizzy, sleepy, or affect our blood pressure, making it easier to fall. All of these causes can work together, making the problem worse. Currently, there is no evidence that shows we can predict a stroke months before it happens. However, there are several risk factors that can greatly increase the chance of having a stroke. These include high blood pressure, smoking, diabetes, high cholesterol, and heart disease. It's very important to control these risks and to live a healthy lifestyle to lower your chances of having a stroke. If you suddenly have trouble speaking, feel numb or weak in your face, arm, or leg, or have a severe headache, you need to get medical help right away. These signs could mean a stroke is happening, and it's important to act fast. Thank you for watching our video. If you find the information useful, please share it with your friends and family to help them learn about preventing strokes. Don't forget to like our video and subscribe to our channel for more health and nutrition tips. We wish you a life filled with health, safety, success, and happiness.